Contraindications or reasons why you wouldn't want to do a massage. There are 3 different types of contraindication, and some of them mean that you can't treat the client at all. Some of them are medical or GP contraindications that would require their permission, either verbally or in person or in writing. And then there's local contraindications. So we need to understand when not to massage so that we can be safe. It's very vital that all therapists know the contraindications of massage, especially the 3 categories that these come into. The first category is a general or total or completely restricted category. Then we have the GP or medical restricted category. And finally, we have local or partially restricted conditions that we can work around or avoid, but we can do the rest of the treatment. Knowing when to treat, when to be cautious, and when to refer or defer a treatment is vital for any therapist to be effective and safe. Completely restricted contraindications or things that you can't massage at all. So if a client comes in with any of these 6 conditions, you really must postpone the treatment, defer it to another time. If they have a fever, obviously if you're going to massage them with a fever, it's going to make them feel very much worse, much more poorly than it was before, because you're stirring everything up. Contagious or infectious diseases, that if there's a temperature or if they've got something contagious, you don't want to catch it, neither do you want it to spread to another client. If they're under recreational drugs or alcohol, well, obviously you wouldn't want to treat them under those conditions either. And if they've got diarrhea and vomiting, which is highly contagious, it's not a good condition. So these 6 conditions are considered things that you wouldn't want to massage anybody with at all. GP or medical consent contraindications is an exhaustive list. To be fair, I mean, there are so many conditions that are being invented, being discovered all the time, that the ones on this list are to give you a good example of the variety of conditions that you either need your client to go and get medical consent from. So the client can go to the doctor and say, look, is it okay for me to have a massage with this condition? They don't need to get a letter. You don't need to speak to the GP direct. If you can, it's great. But generally, patients have to pay for letters and anything in writing these days, and it can take quite a while to come through. So it is perfectly acceptable for your client to sign the consultation form to say, I've spoken to my GP, I have medical consent for me to have this treatment, so they take responsibility. It is also perfectly acceptable for the client to decide, actually, I don't want to ask the GP, it's my body, and I am quite happy to have the treatment. So obviously, you don't self-diagnose, they don't self-diagnose, but they can take responsibility, and you get them to sign to say that that's what they've done. So contraindications really and getting these signatures are all about protecting yourself and watching your back. Bearing in mind that most of these contraindications are really up to your discretion once you've passed as a sports massage therapist or as a therapist, but cardiovascular conditions would be an area where alarm bells would go off with me straight away. If somebody said they had a heart condition, thrombosis, phlebitis, haemophilia, recently had a bypass or heart surgery. I mean, obviously we have guidelines with regard to bypass and heart surgery, and that's usually 2 years for a major operation. We can't massage that area. But having said that, I have had referrals from consultants who've said, as long as you don't apply too much pressure to the back, then they're quite happy for them to have a massage. So we're not really talking about sports massage here, and maybe if you have permission from the consultant, it would be fine to do the lower extremities, different parts of the body. I would be very concerned about anything that's got thrombo in it, because this is a clot, and we certainly don't want to be moving clots around the body. Phlebitis, this picture is the upper leg, but in my experience, most of the phlebitis I've come across has been lower leg. I wouldn't have a problem dealing with hypertension or hypotension. Hypertension tends to be something that people suffer from for a long period of time and is medicated and under control. And hypotension tends to be a healthy option. And as long as you make sure that your client gets up slowly and their temperature, not their temperature, their blood pressure hasn't dropped considerably during the treatment, then you just make sure that they don't pass out actually when you get them off the couch. So cardiovascular conditions would be an area of concern for me, definitely. Medical edema, like the severity we can see in this picture, is not something really that we can treat at all. It tends to have fluid quite often leaking through the tissues, and quite often this sort of condition would be bandaged and treated by a medical team. So it's not something we can treat. Osteoporosis, as long as we're gentle and we're not too rough or aggressive with our treatment, and osteoarthritis is something that we could work around depending on what area it's in and the severity and whether it's inflamed or not. We'd also have to be very careful of treating people with nervous or psychotic diseases, including mental health issues. I think quite often a massage can actually bring out certain symptoms which have been lying dormant in a client for a while. So you have to be careful and be mindful of the effect of a treatment on somebody with these conditions. Not always will a client tell you that they've had mental health issues. So you do have to make sure that there aren't any hidden conditions when a client comes to you for treatment. Epilepsy is considered contraindicated, although in my experience, again, clients with epilepsy do tend to benefit a lot from a massage, as do the extremities of diabetes clients where they have problems with cardiovascular issues with the extremities like the lower leg and foot. Asthmatics, I would always recommend that an asthmatic brings their inhaler with them, and I'd be more concerned about aromatherapy with an asthmatic than I would a sports massage. Bell's palsy is a paralysis of the face which causes a droop on one side of the face due to injury or damage to the trigeminal nerve or the facial nerve. So I wouldn't have any problem treating a client with Bell's palsy. So we do have to use a little bit of logic and understanding with these conditions, because you are qualified therapists now. So these contraindications tend to be for people who've got no experience whatsoever. Dysfunctions of the nervous system we would have to consider, like Parkinson's disease and other conditions. Kidney infections, quite often if somebody has a kidney infection, if we give them a massage, it can put extra pressure on the kidneys as we stimulate the lymphatic system. Spastic conditions, heading really comes into a huge amount of different conditions there, and undiagnosed pain. you would have to take that on a face-by-face individual basis, I think. Cancer is a legitimate contraindication to massage. If the client is still receiving treatment, then they should consult the team and make sure that there isn't any reason why they shouldn't have a massage. Ultimately, it is a client's prerogative to decide whether they have a treatment or not, but it is a good idea to see whether the cancer is in regression or not. If it's in regression, then I have a lot of clients that we are massaging that have had cancer in the past. So whiplash is something I would want my client to go and see the GP about first. I wouldn't want to treat them in case there is a neck fracture that hasn't been diagnosed. Someone with a slipped disc is in extreme pain, and we're very unlikely to have somebody walk in with a current slipped disc. It is something that a lot of people suffer from, and they have got over, and they're not having any experience of treatment or symptoms now. So I wouldn't think that slipped disc is something you'd come across. Postural deformities are obviously something that we can help. If the muscles are pulling the bones out of place, we can help relax the muscles and help the bones go back into place. Taking a prescribed medicine, well, that's sort of half of the population, if not more. So you would have to take that on a individual basis and make sure you understand what the medication is that the client is taking. Trapped pinched nerve is a condition that we could treat, especially if we think the nerve has been pinched by a muscle compression. As with sciatica, it can often be piriformis syndrome, which is being squashed by the piriformis muscle, or if the trapezius is tight, that can often cause tingling and pins and needles in the fingers, which is something we can alleviate if we massage the shoulders deeply. An inflamed nerve is not something I would want to massage. An acute rheumatism would be something I would rather treat after the acute phase and once it's treated. Any condition being treated by another therapist, osteopath, chiropractor, GP, coach, or physiotherapist, well, this is any other practitioner really. So again, you'd have to take it on face value on an individual basis. But most of us work with other therapists and osteopaths, physios, GPs these days. Myositis ossificans is a condition where there's been damage to a muscle and bone forms in the muscle. This can often be in youngsters and children in the larger muscles of the arms and the legs. Periostitis is inflammation of the periosteum surrounding a bone. Piriformis syndrome is when the piriformis goes into spasm and presses on the sciatic nerve, causing pain to go down the back of the leg into the heel. Thoracic outlet syndrome is a condition where there's compression of either the blood vessels or the nerves between the collarbone and the first rib and causes pain in the shoulders, the neck, and sometimes numbness in the fingers. Parkinson's disease is damage to some of the nerve cells in part of the brain. Multiple sclerosis is a condition that tends to come on in early adulthood, which affects the brain and the nerves. For obvious reasons, pregnancy is going to be contraindicated. But again, it depends on whether the treatment can be done sitting up or lying down. Obviously, you're not going to be able to massage a lady in full term pregnancy in a prone position. Recent operations are going to be 2 years for a major operation and 6 months for a minor operation. Motor neuron disease is contraindicated. Bronchitis is an infection, so obviously a bronchitis, emphysema, you wouldn't want to massage somebody with either of those conditions, and Crohn's disease as well. So locally or partially restricted are contraindications that can be avoided or worked around. So these are things like skin conditions, undiagnosed lumps and bumps, varicose veins. You wouldn't massage below them or on them, but you can massage above them. Scar tissue is contraindicated 2 years after a major operation or injury, 6 months after a minor. Sunburn is contraindicated just in the area that you have the sunburn. Recent fractures is a minimum of 3 months for a fracture. And hormonal implants need to be avoided as well as pacemakers. So continuing local and partially restricted contraindications, we've got cuts, bruises, abrasions, localized swellings, inflammation, a hematoma or bruise. You wouldn't want to massage somebody with a hernia unless it's not, you're going to massage around it. Acute sprains and strains, bursitis, carpal tunnel syndrome, Morton's neuroma, areas of altered skin sensation, and irritable bowel syndrome. But obviously these are all partially restricted and most of them we can work around. You need to get your client to self-indemnify the second page of your consultation form. On the first page, there's a list of contraindications, and if any of those are ticked at all, then you need to get your client to flip the consultation form over, and on the bottom of the second side, there's a place where the client can self-indemnify. Either they can tick to say that they've had permission from the doctor or their consultant to have a massage, or they can take responsibility for themselves and decide for themselves that they have a treatment. So you need to explain why it could be a problem, and you must get a consultation form signed and dated, and that self-indemnification signed and dated and ticked. Either ring it A or B, or tick A or B to say that the client is aware that it could be a potential problem. At the end of the day, you need to feel comfortable doing your treatment. So you need to decide whether you feel comfortable regardless of whether somebody self-indemnifies a condition. Sometimes you might have previous experience of mental health issues, which means that you're a lot more comfortable dealing with those, or you might find that somebody who's got cancer just frightens you to death and you don't know whether you can cope with it or not. If in doubt, my rule of thumb is just don't do it. You can ring me if you want to clarify any contraindication at all. You just need to remember that the contraindications that we have in this presentation are for you while you're a student to make you safe. When you are qualified, it is up to you to make that judgment call. So my rule of thumb is if in doubt, don't do it and give me a ring.